and welcome back to day 3 of the Voice Home Pediatrics Spring Newborn Week. My name is Gabby. I'm your host for the week, and we've gone live every day with a Voice Home Pediatrician to talk about a different topic to help you prepare for newborn. So today we're talking about one of our most popular topics, I would say, every spring and fall when we do these seminars, and that is feeding. So whether you are planning on breastfeeding or formula feeding, maybe you're not sure yet, and you're expecting, we've got all the answers for you to help you along with your feeding journey with Dr. Danielle Empson. Dr. Empson, how are you doing today?
I'm doing great, Gabby. How are you?
Great. It's great to have you on. As we go through our discussion on feeding, if you have any questions, go ahead and leave them in the comment section of this video. We have saved time at the end for a Q&A. And of course, we're doing a giveaway as we do every day. So if you are interested in winning a welcome baby package from our friends at Enfamil, go ahead and like this video and leave a comment. You can comment anything, let us know what you've enjoyed about this week so far, your due date, really anything, and you'll be entered to win. And of course, entered into winning our grand prize giveaway at the end of the week, which is a newborn photo shoot with our friend Nikki McLay. Awesome. All right, so we'll go ahead and get into these discussion questions here. The first one, Dr. Empson, what are the benefits and challenges of breastfeeding versus formula feeding?
All right. Well, first, I just want to say hi, everybody. Thanks for joining. Yes, we have lots to cover, and then questions at the end I'm happy to answer. Big question that often comes up, formula versus breast milk, and then there's like bottle feeding versus direct breastfeeding, but lots of benefits for breastfeeding. I feel like a lot of people talk about the benefits of breastfeeding, so I'll highlight some of those, and then we can talk about some of the benefits of formula feeding and then challenges that come with both of those. So breastfeeding is great because it is just what your baby needs. A mom's body makes breast milk perfectly for their baby, and it changes through the stages of that first year of life and beyond if you plan to breastfeed longer. So that is great for baby. The first stuff that comes out of the breast is that really thick, sticky colostrum that is super nutritious for baby. And then it kind of turns into more of that thin, regular breast milk. That is great as well. So benefits are, it's like I said, just what your baby needs. It's very full of antibodies, which are helpful to protect your baby's immune system while they're building up their own immune system. It can decrease the risk of sudden infant death syndrome, diabetes, obesity, asthma, which is great. It is a great way to bond with your baby. It also can be helpful for the mother to decrease like obesity, diabetes, ovarian cancer as well, which is great news. Some of the challenges of breastfeeding can be that it can be a little bit tricky. So everyone kind of says, oh, it's a natural thing, but it can be a little bit tricky to kind of get the hang of things. Sometimes the baby doesn't want to latch right away. So that can be hard. And then if you're the breastfeeding person, then you're kind of at your baby's beck and call. If they need you, they need you. So that's the difference there with formula feeding. Somebody else can feed your baby. And then I wrote some of these down. Oh, and then if you're not with your baby, then you have to pump to keep up with your supply. So that's kind of the other one of the challenges of breastfeeding. And we may touch on some of that later. Formula feeding. One of the benefits can be that you know exactly how much your baby is getting. So a lot of people are numbers people, or if you're type A like me, it's hard if you're breastfeeding because you might not know exactly how much your baby is getting. But with formula feeding, you kind of know because you give it in a bottle. And so they take an ounce or they're taking 2 ounces, you know exactly how much they're getting. Like I said, one of the other benefits of formula feeding is that someone else can feed your baby, which is helpful too. Some of the challenges of formula feeding are that there are so many formulas out there that it can be very overwhelming to try to decide which one you want for your baby. And then sometimes there can be some tummy troubles associated with that. So like, again, figuring out the right formula for your child. I think those are kind of big challenges with formula feeding.
Definitely. And we'll go more in depth into a lot of these. I know parents watching might be hearing buzzwords like latching and supply and saying, wait, I have a question. So we'll go through all of those. But of course, leave your questions in the comments here. The next one is, how can we as parents ensure a proper latch when breastfeeding?
Yes. So, like I was talking about, latching can be one of the tricky things. That's how the baby is sort of attaching to the breast. We want to make sure that the baby has a good latch so that they're successfully removing milk from the breast so that they can keep that supply coming. Breastfeeding is all about supply and demand. So, as baby removes milk, mom's body makes more milk. And that is kind of this continuous cycle. If baby's not removing milk, then the milk's going to sit in the breast and it won't tell mom's body to make more milk. I do have a couple slides. So if you want to bring up that first slide, thanks, Gabby. This kind of shows just like a poor latch versus good latch. So you can see on that left side, if baby's sucking in their cheeks, if they're smacking their lips a lot, if baby's lips are tucked under, or if there's painful nipples during breastfeeding, those can all be signs of a poor latch. On the other side, you see more signs of a good latch. The baby's latching deeply. The chin is against the breast and their nostrils are free. The baby has their lips sort of flayed out like a fish. And the breast feel less full after feeding. So that means the mom or the baby milk. There's one more slide that shows a really good picture of baby latching on. So that far right picture on the top, you can see baby, there's a little bit of we call it an asymmetrical latch, where there's a little bit more of the areola into the baby's mouth. The baby's lips are flanged open like a fish. And so they get that really good latch there. So that's kind of what we're aiming for. Part of having a good latch is positioning of the baby. So there's lots of different ways you can hold the baby. Women with small breasts versus large breasts can definitely have a difference in what position works best to feed the baby too. So we always recommend, like when you're in the hospital and you're practicing latching and breastfeeding and all of that, utilizing the nurses and the lactation consultants as much as you can while you're there so that you feel comfortable when it's time to go home. And then once going home, there's still tons of resources, outpatient, and your friendly pediatrician can help too.
Definitely. Wonderful. What should parents do if their baby is having trouble feeding?
Yes. So like I said, trying to work on feeding in the hospital while you're there can be very helpful. There's lots of resources, outpatient as well. I'll put some of those at the end. I have a little slide. And it kind of depends. So if it seems like it's the latch that's not working well, then you can adjust that. If it seems like baby's latching really well, but they're not getting enough milk, then maybe we have to supplement. If it's a bottle issue for formula feeding or bottle feeding expressed breast milk, then maybe we need a different nipple size, or maybe we need a different bottle that baby works better with. So there's lots of different things that we sort of try to discover what's the cause, why the baby's not feeding. Is it illness, something like that? So we'll work on that with you if you have questions.
Yeah, definitely. And aside from the trouble, what should we do if our baby is fussy during feedings?
So fussiness during feeds could mean a lot of different things. Is it gas? Are they swallowing a ton of air? Is that making them uncomfortable? Some people talk about like milk soy protein intolerance or the MSPI. Are they not tolerating the formula or breast milk because they're having sort of a sensitivity or almost allergy type symptoms with the feeding? So if those are occurring, then we can talk about how to change things, change up the bottle if we need to do that. Do we need to trial a different formula? Does mom need to remove some things from her diet that baby may be interacting with? Is it due to mom's medications? Reflux is another huge thing that we talk about. So reflux is the stomach contents coming up out of the stomach into the esophagus and sometimes out of the mouth. So that could be vomiting, or it could just be really fussy during feedings. How do we help with that? And there are lots of different ways that we can help with that before going to like a medication route or even having to stop breastfeeding or anything like that. As a breastfeeding mom myself, having done it with 2 kids, I know how hard it can be to have to be told that you can't do something that you really have been wanting to do or working on. So we try every way we can to keep encouraging breastfeeding if that's your goal, or switching things around if we need to.
Definitely. And we are going live on Friday. The topic is how to soothe a fussy baby. So that's going to be with Dr. John Vanderhoof, our pediatric gastroenterologist. So if that's something that you're interested in learning more about, we are going more in depth on it for our last live of the week. So stay tuned for that.
That will be a great topic.
Yes, definitely. Let's talk about milk supply. So how can parents increase and maintain their milk supply?
Yes. So, like I said, breastfeeding is all about supply and demand. If we're not removing milk from the breast, then our body is not going to signal the breast to make more breast milk. 10 to 12 milk removals per day is typically what is needed to maintain supply in those early stages. So babies are typically going to be feeding every 1 to 3 hours. If we push it to that 4-hour mark early on, then our supply may dip a little bit. So first things that we usually recommend if we feel like supply is dipping is to try to increase the milk removals, try to feed the baby more. And if the baby's not feeding or not latching well, then pumping, to use a pump to express the breast milk and remove the breast milk. Hydration is also super important, and maintaining good caloric intake for moms is super important as well. So making sure you're staying super hydrated with water or electrolytes and that sort of thing, so that there's enough liquid in your body to actually make breast milk too. It takes a lot of energy to make breast milk. There are also things called galactagogues, a fancy name for like supplements basically that can increase your milk supply. There are several out there. I have a slide on that. I think we skipped one that I'll get back to. Yeah, we'll go back to this one after a minute. And then that one that had a few pictures. Yeah, right here. So these are different things that some people will use to increase milk supply beyond like making sure you're having adequate calorie intake and hydration. But coconut water, fenugreek is a supplement that is in a lot of like the advertised breast milk supplements that you'll see out there, or how to increase milk intake. And then oatmeal is good, and brewer's yeast, which you can like mix in something or having a beer, which is always nice when your doctor tells you you want to have a beer. Great.
It's rare they would tell you, but I guess, yeah, in this case.
Yes. And then if you wanted to go back to that last slide, I just want to touch on this a little bit. This is a big difference. This is like a decent picture that I have seen once before that I kind of replicated as a good picture of like what bottle feeding looks like and breastfeeding. So babies aren't on a schedule at all, but bottle fed babies, since you can see if they're taking sort of the same amount every feeding, it's like a Cheez-It. They're going to take 2 ounces, and then 3 hours later, they're going to take another 2 ounces. And then 3 hours later, they're going to take another 2 ounces. Breastfed babies are a little bit different. They may take half an ounce, and then 30 minutes later they may want to take 2 ounces, and then a few hours later they may want a little snack. So I felt like this was just a good diagram to show like how bottle feeding can be a little bit more scheduled and breastfeeding may be a little bit up and down. And in the very early stages with newborns in general, there's not going to really be a schedule. So even bottle fed babies may do something similar to that bottom picture there.
Yeah, and kind of looking at this, I want to know too, like, how do parents know to follow their baby's cues of when they are wanting to eat?
Yes, so that is a great question. Babies will give us feeding cues before the point of fussiness where they're like hangry. We don't really want babies to be to the crying point before they're going to eat, because that can make it difficult for them to latch on a breast or a bottle if they're just so aggravated and hungry that they are like past the point of wanting to eat. So smacking the lips, rooting around, kind of looking around, turning their head to the side, holding their hands up by their mouth are all signs that baby might be ready to eat before we get to that like hangry crying point. And then once baby is more like satiated, feeling full, you'll notice they'll relax a little bit. They may fall asleep at the breast or the bottle. their hands kind of relax open, and they kind of turn away from the breast or the bottle and sort of open their mouths a little bit. So those are good like hunger cues to kind of watch out for the early signs, and then to know that, okay, baby's probably had a good feeling. And then again, back to what we talked about for breastfeeding moms, like signs of a good latch and a good feeding are that your breasts feel less full after the feeding. So you'll kind of notice things have softened up. Okay, they removed some milk, and then they'll sort of fill up before the next feeding.
Yeah. And that kind of leads me into the next question is how often do newborns eat, especially in the first few weeks of life?
Yeah, so like I said, that picture kind of showed things a little bit, but that's a little bit later on. Newborns typically will say every hour to 3 hours. Early on, like in the hospital, some babies, the first like 24 hours of life are kind of tired. And so they may feed every 4 hours. And we try to tell families, like encourage them, let's try to wake the baby up and feed them at that 4 hour mark because they're probably getting hungry. And then typically once they grasp things, those first few weeks, couple months, every 1 to 3 hours is very typical daytime and nighttime. If they have a really good feeding, then they might go 3 hours between feeds. If they took just a little snack, they're probably going to be hungry again that next hour. So it really does feel like a breastfeeding mom is like a full-time job. You're around the clock, 24/7, nurturing and feeding that baby.
Mm-hmm. Yeah, I know we've gotten that question when we've talked about this before is, if my baby is doing a good job sleeping in the night, do I still need to wake them up to feed them? And the answer is yes.
Yeah, so those first couple weeks, especially, all babies lose a little bit of weight while they're in the hospital. And those first few days of life, that's very normal. But we want them to be back to birth weight by 2 weeks. So we really encourage, like, at 1 to 3 hours during the day, at nighttime, set your alarm. If it's been 4 hours, try to wake them up and feed them. Because if they're not wanting to feed too, then sometimes that can be concerning to us. Are they going to get enough? Are they ill? Is there a reason why they're not feeding as frequently as we'd like them to? And then once they're back to birth weight, if they want to do a little bit longer stretches at night, we're okay with that. But it's always a good question to ask your pediatrician to make sure, like weight gain, that's really a big thing that we watch early on, that weight gain is adequate, wet diapers, poopy diapers are adequate, and that's a good indication that baby's getting enough, especially when you're breastfeeding, you don't know how much baby's exactly getting.
Right. Yeah, definitely. All right. We have just a few more questions on our list for Dr. Empson. So if you're watching live and you have a question on feeding, make sure you leave it in the comments now so we can get to it in time for the live Q&A. And of course, if you're watching later tonight or maybe over the next few days and you have a question, you can still comment it and we can get back to you with an answer. Okay, so bottles. We would love to know what are some recommended bottles for formula feeding? That's one question. And then another question would be, a lot of moms aren't exclusively feeding on the breast all the time. So putting breast milk in a bottle, which ones would you recommend too?
Yes. I don't have specific recommendations for what bottle is the best because there are a million out there and there are a million different nipple variations out there too. I say the best bottle is the one that your baby takes and then
Yeah.
isn't super fussy with. So there are certain bottles that are like marketed to be anti-colic bottles, meaning the baby maybe doesn't swallow as much air, doesn't get a lot of gas in their tummy and that sort of thing. So just being mindful of that, but like you don't have to get the most expensive bottle out there. I will say I've myself just personally have been looking in more into like plastics and things like that. So some people prefer glass bottles versus plastic bottles, and that's totally fine too. The nipples are usually made of silicone, so not as much of an issue of like those BPA's plastic stuff there. But that's something to sort of keep in mind. They make bottles that look more or like act more like natural, like a breast. But I really say whatever bottle your baby's taking is fine. Early on, we recommend a slow flow nipple, so those smaller size nipples, especially if breastfeeding, because that mimics the baby has to work a little bit harder to get the milk out of those bottles when there's a slower flow nipple. So that kind of mimics breastfeeding. Those faster flow nipples, baby doesn't have to work as hard, and then baby may develop a bottle preference where they don't necessarily want to go back to the breast because that's a little bit of work for them. So just being mindful of that too. But again, yeah, there's millions of bottles out there. If one doesn't work, it's always fine to trial a different one. If you find one that works, then that's what works.
Mhm. And what about, as baby grows, do we move up in bottle size or nipple size? How does that work?
Yeah, that's another great question. So, typically, like the newborn bottles will be like 4 ounces or something like that. As baby gets older, they may take more volume than 4 ounces at a time. So, you might have to get bigger bottles. Same thing with that nipple size. As babies go up in age, they can tolerate a faster flow through the nipple. And if they're really like established with breastfeeding and don't really have any confusion going back and forth between a bottle with express breast milk or a bottle with like formula supplementation and going back to breastfeeding, then that may not be an issue as they get older. And then what I was going to say was my first baby, he never took more than a 4 ounce bottle. So we always had the small bottles from newborn till he was like a year old.
Yeah.
He never just took more than 4 ounces at a time. My daughter was a little chunkier and she wanted to do like 6 to 7 ounces as she got older. So we did end up having to buy bigger bottles for her.
Yeah.
Trying to think what else. Formula and bottle. Yeah. So like once if kids are going to daycare or somebody else is feeding the baby, bottles are a great, great way to allow somebody else to feed your baby so that you're not always having to breastfeed. And then express breast milk can go on the bottle just as well as formula.
hmm Yeah. And one more question on formula. Sorry, I don't have this on my list, but I
Yeah,
should
that's
have
fine.
had it. Would be, I see a lot of times people will prep bottles in advance or do, like a pitcher of breast milk in the fridge for overnight. Do you have any advice or practices on prepping milk ahead of time?
Yeah. So, I honestly, it's like whatever is easiest for you. Now, once a baby has latched onto a bottle, then there is introduction of bacteria. So then you have to use that within a certain amount of time. But if there's bottles prepped in the fridge, then if it's like express breast milk that's fresh, that can be in the fridge for a little bit of time. If it's breast milk that has been frozen and then thawed, then I think that's usually about 24 hours. There are different guidelines. CDC has recommendations on all of that. But yeah, batching bottles, whether it's formula or breast milk ahead of time, getting things like ready for daycare. Some daycares, you have to come with the bottles like pre-measured out and labeled and all of that. That's how our daycare was. Um, and some are like, bring us the frozen breast milk and we'll make the bottles for you. So whatever works for you guys. There's lots of different ways to like do that. But yeah, being able to prep bottles ahead of time can be very helpful, like before nighttime, before sleeping, and not having to worry about that in the middle of the night can be helpful too.
Yeah.
I don't, I'll wait till the end because are we talking about different types of formula too? Was that one of the questions?
Yes, we did. Struggling with feeding. We didn't have it on our list, but we should. So
I'll
yeah.
just talk about because that kind of goes along with the bottles. Like I said, with bottles, whatever bottle your baby takes is a great bottle for your baby. That is similar to formula because there are a billion out there now. And so some people will come to me and be like, what about this formula? And I'm like, I've never heard of that one. I got to look it up. But most of the formulas out there that you can get in the United States are FDA approved. They are safe for your baby. There are tons out there. So again, whatever one you sort of decide to start with, if it works for your baby, great. If we need to make adjustments, there are lots of different kinds of formula out there that we can help you kind of guide you in directions that are better.
Yeah. And how does it work too, like with switching formulas? So say, baby's on one and you're noticing they're not doing so well. Maybe they're really gassy, fussy.
Mhm.
What does it look like to switch over? Do you like mix them or how does that
Yeah, so a lot of times it just sort of depends on the baby's symptoms. If the baby's super fussy or uncomfortable and like we need to switch something right now, that's fine. What I tell families is that anytime we are transitioning or making a change, whether it's a change in mom's diet, we're eliminating something from mom's diet if we need to do that, or changing formulas. Babies take their tummy sort of takes about 2 weeks to kind of get used to the new formula and settle out. So, like, if we're changing things really quickly, we're never going to know what's making a difference if we're not giving it time. And sometimes with babies, some babies are fussy no matter what we do. We could change the formula 100 times. We could remove everything from mom's diet and baby would still be fussy. That's colic. That's a kind of a different talk. Dr. Vanderhoof will probably touch on that on Friday. So I say give it a good 2 weeks before we make any adjustments because some of it might just be timing too. But then that way we know, okay, this really isn't working. We might need to make an adjustment again.
definitely. So we talked about recognizing when baby is hungry, but how do we know when they are full?
Yeah, so I think I did touch on that a little bit, but if baby's getting sleepy, if baby's kind of turning away from the breast, if their hands are sort of open, their mouth kind of opens and they just seem happy and
Mhm.
calm, then that's usually a good sign that they're full.
Good. Perfect. We'll make sure to have that. Awesome. And then this is a good one, especially because, you said earlier that if you are a breastfeeding parent, it can sometimes feel like an around the clock job and you're kind of on call for your baby. So, in those moments, how can partners support them during feeding times, whether they're breastfeeding or formula feeding?
Yes, so many ways. I love this question. Um, so having like a little lactation station or snack supply where you've got your drinks and some snacks, you don't have to get up and the diapers are there and the wipes are there. I think that can be really helpful, just have everything close by because nursing is, I mean, some people can do it while they're walking around standing or babies in a carrier as they're a little bit older, but most of the time you're gonna be sitting down or relaxing a little bit to try to feed the baby so that both mom and baby are comfortable. So partners can bring supplies. Partners, this is a commitment. And so it's a commitment on both ends with both partner, with mom, dad, partner. I feel like if the mom is or the breastfeeding parent is committed, like this is what we want to do, then hopefully everybody is on board with that. Hydration, like we talked about, super important. Making sure caloric intake is there. Partners can change the diaper before feeding time and get the baby, redressed after feeding time or change the diaper after feeding time, burp the baby, help with bottles. If mom is pumping, cleaning pump parts, I always think is a great job for the partner.
Yeah.
These are the things that I am saying to my husband when I was 2 months postpartum.
Right.
So don't take that in the wrong way at all.
For sure.
Positioning is also helping making sure a breastfeeding parent is comfortable. So like the pillows, blankets, do you need anything? Just helping out in any way. Because once you're sitting down and starting to feed the baby, or if it can be a sort of a stressful feeding situation for the baby's not wanting to latch, just having that partner there to sort of be a calm presence.
Yeah, definitely. And we just have a couple more minutes, but I noticed we haven't talked about pumping at all. So if you want to touch on that, are there any pumping tips you have or pumps you recommend?
Yes. So pumping is helpful to remove milk from the breast when mom cannot directly feed the baby. So anytime the baby is getting fed via a bottle or like somebody else is feeding the baby, then you're still going to want to be pumping to maintain that supply. So again, the 10 to 12 milk removals per day early on, whether that's via the baby removing the milk or the breast pump removing the milk, can be helpful to maintain that supply. As things progress, baby gets a little bit older, that number goes down a little bit. There are, depending on your breast capacity, how much milk you can hold in your breast, and how quickly you refill your breast all depends on how many milk removals you need per day. There's something called a golden number. There are tables out there that you can always look at or ask if you have questions. But pumping can be super beneficial if parent is going back to work or going to be away from the baby for a trip or something like that, to maintain milk, bring it back home and give that to baby the next day while the baby's at daycare or whatnot. Freeze it in the freezer. The pump there are tons of pumps out there. Again, that's going to be the same as the formula and the bottles, whatever one works for you. They now have portable pumps. They have much smaller pumps, like the size of a cell phone. That was what I had with my second baby, and it was amazing. They have cups that just go in the bra that are very discreet pumps that you can pump on the go. Battery powered, all of those, super nice, great. Tons of pumps out there. So whatever kind of works for you, what your insurance covers. But read about them because there's lots of options and you can find what works best with your lifestyle.
Yeah, perfect. All right, well, we just have one more question on our list and then we'll go into the Q&A. So if you have a remaining question on feeding, make sure you comment it and then we'll draw for the giveaway afterwards. Dr. Empson, what are some common feeding myths that you would like to dispel?
I think I wrote some of these down, so I gotta look. Okay, so
Yeah.
one that we sort of touched on, breastfeeding is natural and easy. Not necessarily. My first baby breastfeeding was very painful in the beginning, and I was like, I thought this was not supposed to hurt. And my pediatrician for my kids came into the room and she was like, I had toe curling pain when I was breastfeeding my first. And I was like, thank you for saying that because that's what it feels like to me. And then eventually that went away as things got better within a week's time. And I'd look down and be like, are you even latched right now? Because you just lose sensation a little bit. That's fine. But may not be natural or easy in the beginning. There's tons of resources out there. So that's one of them. Let's see. Oh, we talked about this a little bit too. One of the myths, newborns need to be on a strict schedule. They're not going to be on a schedule. So they may feed every 1 hour. They may feed every 3 hours. They may want to feed in between. So that's fine. And then same with sleeping. Like sometimes they're going to sleep 30 minutes at a time, sometimes 2 hours, maybe if you're lucky, 4 hours at a time. So no need for a schedule, especially in those first couple weeks, kind of going with the flow. We say feeding on demand. When the baby wants to feed, then you can feed the baby. Another one is don't mix breast milk and formula or bottle feeding and breastfeeding because there will be confusion. No, a lot of people supplement their breast milk or breastfeeding with formula, and that's totally fine. And then pacifier. And a lot of people ask about pacifiers. When can we introduce a pacifier? Ideally, we love to make sure baby has a good latch before introducing a pacifier, but sometimes we introduce them in the hospital, and that's within the first couple days of life, and babies do totally fine. So if you feel like baby has a good latch, then it's okay to introduce the pacifier. If you don't want to introduce a pacifier, you don't have to. That's okay too. Another myth, you shouldn't breastfeed if you're sick. That one's false. Like I talked about in the beginning, moms make great antibodies in their breast milk, and that just helps baby improve if they're going to get sick too. So babies don't have all the antibodies that we have, so that actually helps them. A lot of babies will swallow antibodies through the breast milk, and that actually gets absorbed into their bloodstream to help them fight infections, which is fantastic. That's also the similar way how vaccines in pregnant women and moms work for babies, because moms are passing along those antibodies in utero, but also passing along those antibodies through the breast milk. This kind of goes along with that. You can't take medicine while breastfeeding. That's false. There are certain medications you cannot take while breastfeeding. So if you're starting something new or have questions about something, please ask your doctor. Even some over-the-counter medicines can be harmful for babies who are being breastfed or can inhibit milk supply. So we want to be mindful of that because we don't really want to take things that are making our supply go down. But there are lots of medications that are definitely okay for breastfeeding. And then this one's not necessarily a myth, but I always like to touch on this, pumping and dumping. And people always talk about this, like, when do I need to pump and dump? So certain medications, potentially you might have to pump and dump. A lot of people bring up alcohol, like drinking alcohol while you're nursing a baby. My tips on this is if you are like okay to drive, if you are comfortable holding your baby, you can feed your baby. If you've had a drink or two, you're probably okay. If you are totally lights out drunk, then you don't want to feed your baby. However, the amount of like blood alcohol content, the amount of alcohol in your bloodstream is the same as it is in the breast milk. I think blood alcohol content, the legal limit is 0.08% or whatever. That's probably like what's in a glass of orange juice is what's in our blood. So probably okay for baby, but beyond, we just want to be mindful. And then, yeah, so as we're metabolizing alcohol in our bloodstream, it's also metabolizing in the breast milk. So once you're feeling okay, then it's okay to breastfeed again. So that's always a little bit controversial topic. You can talk to your own pediatrician or your doctor about that.
Yeah.
I'm happy to answer any questions on that. You don't always have to pump and dump by any means if you've had a drink or two.
Yeah, perfect. Very helpful. Thank you. I know you have one more slide on the PowerPoint, so I just want to show it here.
Oh, yes. This was kind of a little meme that I always tell families. When I was on maternity leave with my husband, I would be so exhausted. My husband would come home from work and say, "Did you nap today? Did you get in a nap like I told you?" And I was like, no. He's like, what'd you do? I was like, well, who's going to fold the laundry? Sleep when the baby sleeps, fold laundry when the baby folds laundry. That's just the motto for like the first few months of a newborn. So hopefully that gives you a couple giggles because it always did for me. Yeah. And
Yeah.
then I think that very last slide, there might be just a couple resources on
Oh,
there
yes.
too, as far as lactation, support.
Yes.
So your pediatrician can always help with any lactation support you may need. Lactation consultants, there are some in your pediatrics clinics. They are in the hospital where you're delivering your baby. They are outside of the hospital are several resources in town that you can go to, but there are also now lactation consultants that will come to the house. So they can be very helpful. And that is often covered by insurance, which is great. They can help you with pumping and all of that. They can do what we call pre and post weighted feeds. So they can weigh the baby before a feed and after the feed to see how much milk is actually transferred, how much milk your baby has taken. So you actually know, oh, wow, they took 2 ounces that feeding. Healthychildren.org is the American Academy of Pediatrics website that we guide a lot of parents to. There's tons of information on there, but you can then search specifically like breastfeeding, bottle feeding, formula feeding. And then those last two are really more specific to breastfeeding, but kellymom.com is a great resource, has lots of information about breastfeeding, and then La Leche League.
Yes. Perfect. Thanks for sharing those. And yeah, we'll link to those in the comments as well for everybody watching. All right, so for the Q&A, I see one come through, and then we'll pull for the wheel here. So we have a question. Can you talk a little bit about formula temperatures?
Yeah. Yes. So reheating breast milk or formula, warming it up, you want to not do it in the microwave. There can be hot spots. And then again, the plastics and leakage of the BPAs and all of that. So you can use a bottle warmer, which is like a device that you buy, plugs into the wall, you put water in it, and then it circulates. You put the bottle in, it circulates water around the bottle to evenly warm up the milk. Or you can just do that with a bowl from hot water from the sink. You always want to test the temperature, usually on like not a hand because the hands sense temperature a little bit differently. The wrist, a lot of people like do on the wrist, test the like milk coming out of the bottle on the wrist, make sure it's not too hot. We don't want any scald burns or anything like that in the baby's mouth. But like body temperature is, what are we, 98 degrees? So around there, a little bit warmer is a-okay.
Perfect.
If baby takes the formula cold too, or room temperature, if they're going to take it that way, go with it. Then you don't have to warm it up or worry about warming it up.
Yeah, less step for you, right?
Yes.
And then also we had a question on sterilizing bottles.
Yes. So we want to sterilize bottles, all like anything that goes in the baby's mouth, basically. Excuse me, I'm gonna grab a sip of water.
We've got you talking a lot, so.
I know. There are sterilization bags. You can boil water in a big pot on your stove and put your pump parts, bottle parts, nipples from the bottles, pacifiers in there for about 5 minutes. That will sterilize things. When babies are younger, you want to sterilize things very regularly, nearly after every use. As babies get a little bit older, at the end of the day, or at least cleaning the parts. So dish soap and warm soapy water to clean things off pretty regularly.
Perfect. Awesome. Great questions, everyone.
Oh, I was going to say too, there are like sterilization things that you can buy now that just kind of do it all for you. Put it on your countertop, plug it in. So that's really handy. And then the sterilization bags where you put everything in a bag, pour a little bit of water in it, and put that in the microwave. That's also an option. That's kind of what we use and is very handy, but I forgot about those.
Yeah, no, that's great. I know I've seen that one. It's almost like a dishwasher.
Yes.
That you stack it looks so handy. Yeah. Awesome. All right, great. Well, thanks everyone for your great questions and for all the kind comments. Lots of people saying great info. Thank you, thank you. So you're welcome. We love to provide this free resource for you. So
yes.
All right, we'll go ahead and spin the wheel here. And today's winner for the giveaway is Brooke S. Congrats, Brooke. We'll send you a message to help you claim your prize. And of course, like I said, we still got 2 more opportunities for a live giveaway Thursday, Friday, and then also we'll draw for the grand prize winner. So keep tuning in and liking the video and leaving comments, and we love to hear from you guys. So Dr. Empson, thank you so much for all your expertise.
Thank you. You guys have a great day.
All right. Thanks, everyone. We will see you tomorrow at noon. Bye-bye.